Hey, just to go back over this, because I know it cut off on the last thing, but is psychotherapy effective? That's what we were talking about in the last PowerPoint. It's difficult to gauge the effectiveness because there are different levels upon which its effectiveness can be measured. So thinking about improvement, does the patient see improvement, therapist see improvement, friends and family, how do they feel about improvement? The client's perception, that's what we call the people who are in therapy, or clients. If you ask clients about their experiences of getting into therapy, they often overestimate its effectiveness. Clients enter therapy in crisis, but the crisis may subside over the natural course of time, like the regression to normalcy. So when they go into therapy, it may seem very overwhelming, and then over time, it's going to get better. Clients may need to believe that the therapy was worth the effort. If I'm talking, if I'm spending the money, I want to see improvement. So there's some of that built-in kind of attitude. And clients, they generally speak kindly of their therapist. They like them. They feel like they listen to them maybe when nobody else does. So the clinician's perception, like clients, clinicians believe in therapy success. They believe the client is better off after therapy. Clinicians are aware of failures, but they believe that failure is the problem of like other therapists. Like, not my problem, it's their problem. If a client seeks another clinician, the former therapist is more likely to argue that the client has developed another psychological problem. I'm not wrong, you have more problems. And then clinicians are likely to testify to the efficacy of their therapy regardless of the outcome of their treatment. So they feel like it's efficient, effective, even if it's not. How can we objectively measure it? Meta-analysis of a number of studies suggests that thousands of patients benefit more from therapy than those who do not go to therapy. You can see here research shows that treated patients were 80% better than untreated ones. The relative effectiveness of different therapies, what therapy fits what problem, depression, behavior, cognition, interpersonal therapies, anxiety, cognition, exposure, stress inoculation. Bulimia is usually a case of cognitive behavior. Phobias or behavior, and bedwetting again is behavior modification. Evaluating alternative therapies, Lillian Fields suggests comparing scientific therapies against popular therapies through electronic means, and the results of such a search are below. So you can see how the different type of like therapeutic touch, St. John's wort, personality typing compared to something like systematic desensitization compares to other eclectic kind of therapies. You also have EMDR, which is eye movement desensitization and reprocessing. The therapist attempts to unlock and reprocess previous frozen traumatic memories by waving a finger in front of the eyes of the client. It's not really held up in scientific testing, but you do need to make a note of it. Then there's light exposure, which is a form of depression that's treated by light exposure therapy, the form of therapy. It's been scientifically validated. You have commonalities among psychotherapies. So 3 commonalities are a hope for a demoralized person, a new perspective, and an empathetic, trusting, and caring relationship. Psychotherapists differ from each other and from their clients and their personal beliefs, their values, the backgrounds. That's why you really have to have a lot of visits. You need to make sure that you are comfortable with that person to see like which type of therapist really fits you. You have clinical psychologists. They usually have PhDs. They're experts in research, assessment, therapy. You have clinical or psychiatric social worker. They usually have a degree of Masters of Social Work. Postgraduate supervision prepares them to be social workers. They can offer psychotherapy. You also have counselors, like abuse counselors, family relations, spouse, child abusers, their victim substance abusers that will maybe go to abuse counselors, or your pastor can also falls into that category. Psychiatrists, they are physicians who specialize in the treatment of psychological disorders. Not all psychiatrists have extensive training in psychotherapy, but they can prescribe medicine because they are MDs. So then we look at biomedical therapies. These are things that include physical, medicinal, other forms of biological therapies, drug treatment, surgery, electric shock therapy. Drug therapy, psychopharmacology is the study of drug effects on the mind and the behavior. With the increase in drugs and the use of drugs to treat psychological disorders, we've really seen a decrease in the hospitalization of most mental patients. However, many patients are left homeless on the street due to their ill preparedness to cope independently outside in society. Just because you're treating it with a medication doesn't necessarily make you able to cope with it, and so a lot of times they have a hard time like sustaining a job or being a part of a family or a group setting. In double-blind procedures, to test the effectiveness of a drug, patients are tested with a drug and a placebo. Two groups of patients and medical health professionals are unaware of who's taking the drug and who's taking the placebo. So you can see inappropriate symptoms are present, positive symptoms, hallucinations, disorganized thinking, diluted ways, appropriate symptoms, negative symptoms, apathy, expressionless faces, rigid bodies. All of these are characteristics of schizophrenia. So antipsychotic drugs that are used to treat some like schizophrenia, that would be a drug that would be treated mainly and a lot with the biomedical therapy. Classical antipsychotics, thorazine, it removes a number of positive symptoms associated with schizophrenia, such as agitation, delusions, and hallucinations. Atypical antipsychotics, something like clonazepam, remove negative symptoms associated with schizophrenia, such as apathy, jumbled thoughts, concentration difficulties, difficulties in interacting with others. You can see here an atypical antipsychotic like clonazepam blocks receptors for dopamine and serotonin to remove those negative types of symptoms. Anti-anxiety drugs, things like Xanax, Ativan, depresses the central nervous system, reduces anxiety, tension. So if you have an anxiety disorder, you may take Xanax. By elevating the levels of the GABA neurotransmitter. So when you think about anxiety, you need to think about Xanax, Ativan, but you also need to think about increased levels of that GABA neurotransmitter. Antidepressants are things like Prozac, Zoloft, Paxil. I feel like we've all heard those on commercials, but they're called SSRIs. They're selective serotonin reuptake inhibitors that improve the mood by elevating these levels of serotonin by inhibiting the reuptake, so there's not as much absorption. And then you also have mood stabilizing medications. They used to use lithium. A lot of times that was used to stabilize manic episodes and bipolar disorders. It moderates the levels of norepinephrine and glutamate neurotransmitters. You also have electroconvulsive therapy, which is electric shocks. It's mainly used for depressed patients who do not respond to drugs. So the patient is given a muscle relaxant, and they usually get about a 100-volt shock that relieves them of depression. So these ECTs are usually used with people who are depressed, sometimes with schizophrenia, but mainly for depressed people who drugs have not helped. Alternatives now, they use like transcranial magnetic stimulation, TMS, which is a pulsating magnetic coil. It's placed over the prefrontal regions of the brain to treat depression, and it really has minimal side effects. You can also have psychosurgery. Psychosurgery was popular even in Neolithic times. It's not used that much today. We saw the videos with the lobotomies, so it's not used really all that often. You can see it right there. Psychosurgery is used as a last resort. It's irreversible. You remove part of the brain tissue with the idea that you will then change the mind. Modern methods are stereostatic neurosurgery and radiosurgery that refine older methods of psychosurgery. It's probably a little bit more humane than what you saw in the lobotomy video. So how do we prevent psychological disorders? Because it's probably better to prevent than to cure. Preventing psychological disorders means removing the factors that affect society. Poverty, meaningless work, constant criticism, unemployment, racism, sexism, and there are a whole host of things that can cause psychological disorders. So psychological disorders are biopsychosocial in nature. So they are, meaning that there are social cultural considerations for reasons. There are biological reasons. People who have genetic disposition to have a psychological disorder that can be exacerbated by things in your culture, in your society, in your social settings. And then you also have like psychological considerations to take into mind, like mood swings and those kind of things, like the mental aspects of it all go in to what are we going to do to help with a psychological disorder. And that is it. So your test is coming up. If you have any questions, let me know.